So the other thing back in the sort of into the 90s that was very looking exciting was oestrogen and the use of oestrogen, and one study sort of that was not a randomised study showed that yes, it did seem to work, but then when they randomised it, it no longer seemed to have much of an or not an ongoing effect. And because the doses they were using, it looked like it was pretty clinically unusable, even if it was telling us something about what was happening. And as I said, we found out progesterone wasn't the way to go. There were also a lot of prevention studies back then, and really what it proved is you really needed to identify these people, and certainly if they'd had a previous depression, which was one of the previous risk sort of factors, they were the people that needed a lot of support. But ultimately it was early intervention that seems to be clearly the thing that stands out as what you need to do. What's really sort of changed over the last 20 years is the biology. I'm not a biologist, I don't do this research, but I have to say I was jumping from lecture to lecture, running all over the complex in India, including across roads, and believe me, that was taking your life into your own hands. But it was worth it. These lectures were really exciting. So I'll kind of go through, because I haven't done this research, so I'm just going to sort of touch on some of the research that was there that kind of flared my excitement. So cortisol studies have been around for a while, and so the ELSPAC study, the AVON study from the UK, they followed these women through pregnancy, and now those children are having babies. So there's some really exciting stuff coming out about this sort of intergenerational things that have changed and what they can tell by this. So what the early studies were showing was, well, first of all, that these children who were born to particularly anxious but also depressed mums were born with altered stress reactions, higher cortisol at birth, but ultimately altered stress reactions, and that this seemed to be a marker for their later risk, particularly for anxiety and depression. And these children are at higher risk of mental health problems throughout their childhood and into adulthood. So there was things like they were looking at these pregnant women, not necessarily in this study because there are a number, there's a South London study that's also got long-term data, which is also the advantage of time. We're now getting some of this, really long longitudinal data, prospective longitudinal data. And they were looking at pregnant women and stressing them, and looking at the fetuses' pulse rate and what was happening to them, and found that women who weren't anxious in pregnancy, but you then stress them by making them stand up and talk to an audience. And the women's pulse rate, blood pressure, cortisol, everything was going up, but the baby's pulse rate stayed even. But if you did the same thing to women who were suffering from anxiety disorders, their anxiety went up, but so the baby's pulse rate and markers also went up. So they were already in tune in utero. So this really marked things happening early. The attention now is heading towards the placenta. In fact, one of the studies had a placental SWAT team that was sending these researchers out, because if you only collect placentas between 9 a.m. and 5 p.m, you're not going to actually get about 60% of the placentas that you need to look at. So they were getting placental SWAT teams with all sorts of, beepers that go off in the night, as far as I could tell. And certainly they've noted that the vascularisation and the enzyme activity of the placenta in stressed mums seems to be different. So there's kind of a real focus on what is happening with the cortisol. Now, you'll notice that I said this before, there was the cortisol, the immune markers, the microbiota. I'm kind of trying to tease them apart, but that's not to say that they are actually teasable apart, because these are interwoven, these issues. I have a particular interest in adverse childhood events because that was what my MD thesis was on. And I have to say, someone was presenting at this conference on this as though this was new. And I'm thinking, well, hold on, my thesis was like 1990s I was doing it, certainly published then on childhood abuse as being a risk factor for postnatal depression. What I didn't do then, and what has been done now since, has been to sort of link some of the biology with that. and certainly women with abuse histories do tend to be the group that don't do so well with depression generally, but particularly also with postnatal depression. It increases the risk and increases the risk for their children as well. And now they've also noticed that a trauma history, there's an increase of one of the immune markers found in pregnancy. And there's also now some work trying to tease out what it is. Is it about attachment, or is it about the biology that's transferring this intergenerational transmission? There's certainly been lots of psychological studies on these children and the internalising and externalising problems that these children have, and then they become adults with these similar problems, and a lot of attachment work done with this group too. So we know that the babies of antenatally depressed mums have children whose responses are altered, and we've now got a lot of work looking at these inflammatory markers, and that pro-inflammatory markers have been associated with depression and anxiety being present, and vice versa. So that this is an area of enormous, there's quite a number of researchers at this conference we're talking about. And then following these babies up and following them up, and they followed the babies up when the babies had immunisations, and found that the babies of non-anxious depressed mums didn't really have much of a reaction stress-wise, whereas there were very significant alterations in those children, particularly if they had the double whammy of the trauma-historied mother and who was also anxious depressed in pregnancy. And these mothers have, altered immune markers as well. So there were also some gender differences noted, and again, this is where the placenta came into play, and some really interesting comments about only the super males that survived. They did suggest that wasn't necessarily a good thing, and seemed to think that super males and Trump were kind of in the same kind of line. So I think what they were really referring to was if the placental strategies were the female babies were able to adapt in utero, males less likely to be able to, but those that did were programmed to be more of those quintessentially male characteristics that were a feature in these children. So there's a lot more work to be done in this area. These were just sort of early data, but just kind of really interesting. And we know from attachment studies that there are gender differences in these babies as early as 3 months of age. So just on the inflammatory markers, these are kind of some of the things that were coming up. This is just one of the IL-6. It's just one of the ones that was increased in antenatal depression. And there are sort of implications for general health, not just mental health as well, because that's also associated with diabetes, high risk of diabetes and heart disorder. As I said, these babies are being followed up, and a lot more work needs to be done into it. What seems to be happening is that with this is that there's a sort of an option for some of the tryptophan to go which path it's going down, and that the inflammatory markers and the microbiota, which I'll go into in a minute, have a part in which direction that goes, and then you end up with different metabolites and therefore different levels of neurotransmitters, which that's the kind of hypothesis at the moment.